Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome, everyone, for another episode of the Pharmacists Are In podcast, Canada's #1 podcast for pharmacists. I'm your host, Ajit Johal from Vancouver, BC, and I'm joined by my esteemed co-host, Dr. John Papastergiou. John, how are you?
Excited to be here. This is one of those episodes I've been waiting to do for a while, so thanks, Ajit, for arranging it, because I think it's going to be of super interest to our audience.
Yeah, I'm really excited about this episode because I've been working in the immunization space, as you know, since I graduated. I run a not-for-profit called Immunize.io, and our mission statement is taking our best shot at immunizing the world. And how do we get the world vaccinated? Well, we need more shots in arms, and we need to combat the sea of misinformation and disinformation out there. So very happy to have our two guests from the Children's Hospital of Philadelphia, Dr. Paul Offit. And I've been a big fan of Paul's for a while. I've read most of his books, I think almost all of his books, because a lot of them are on Audible now, so that helps. And follow his Substack form. And just as any sort of vaccine educator, I always see Paul as sort of a wealth of wisdom to not just for clinical expertise, but really guiding those conversations and misconceptions. Because a lot of times when I do presentations, John, for pharmacists, they'll say, well, a patient said this and I just didn't know how to react to it. And Paul has seen it all, and he's just got such eloquent explanations to all of it. So thank you, Paul, for joining us today.
Thank you.
And we also have Charlotte Moser as well from the Children's Hospital of Philadelphia. And Charlotte is a co-director and scientific communicator, and also plays a huge role in supporting health literacy, vaccine literacy, and all of the great work that's coming out of CHOP and the Vaccine Education Center. So Charlotte and Paul, thank you so much for being here today. And I just want to start with the elephant in the room, is what's going on in the United States. And gosh, yeah, keep fighting the good fight, but just give our listeners, especially in Canada and even across the world, right, John? There's listeners from all over looking at this, and kind of just give us how are you navigating these stormy seas, and what's the current state of play when it comes to people accessing vaccines?
So the world has turned upside down in the United States. We have a Secretary of Health and Human Services, Robert F. Kennedy Jr., who for 20 years has been a virulent anti-vaccine activist, shouting from the sidelines, shouting that vaccines are unsafe, shouting that vaccines are ineffective, shouting that vaccines cause a variety of chronic diseases. Now what's changed is he's in a policy-making position. So he's taken that zealotry, that anti-vaccine zealotry, and brought it into a public policy forum. And so I think people like Charlotte and I and others are doing everything we can to try and fight back on all this misinformation. But because of his now powerful political position, it's gotten much harder.
Yeah, just to kind of recap because I mean, I've been following this, but how did RFK Jr. become the HHS, in that position? It needs to be confirmed, and people need to there's certain internal layers that approval that need to go through. I mean, I would imagine there'd be some checks and balances to this.
Yes, I would have imagined that too. I mean, like if we had a Congress, for example, sure, I would have imagined that too. Now, I think what's happened is one thing that RFK Jr. said that I think is true is he said, I'm here because of the COVID pandemic. And I think what happened during the pandemic, especially those first 2 years, there were government activities, whether it was closing business or shuttering schools or requiring a vaccine card for anything you did, including, going to a sporting event or bar, or you might get fired from your job. I think we leaned into this sort of libertarian left hook and created this anti-government backlash. And that's what he represents. I mean, the government sets public policies. And now we have sort of an anti-public policy person in RFK Jr., who normally with public policy you make recommendations, but he, as well as many of the people who he has working under him at the FDA or NIH or CDC, constantly make a point about how, your decision, you do what you want to do, it's up to you, just be informed, at which point they do everything they can to misinform those people. But nonetheless, that's what I think we're dealing with, this kind of anti-government backlash, which means anti-public health in many ways.
Charlotte, so we had the longest lockdown, I think, in the world here in Toronto and in Ontario. We were locked down for a long period of time. I think that created it helped to kind of create this anti-vaccine sentiment. But what we don't see here, usually when I hear, oh, the vaccine doesn't work, or, I took too many, but what we're seeing in the US is very different. It seems like an attack on vaccination in general. There doesn't seem to be any real evidence to support it, just people giving anecdotal stories. But it seems like there's a movement behind it. How did that all unfold? Because we haven't seen that necessarily here in Canada.
I think Robert F. Kennedy Jr. had a part in that as well. I mean, really, if you look back at October of 2020, before a vaccine was even out, he and several other, what we like to call professional anti-vaxxers, people who, spout anti-vaccine rhetoric as, regularly, they had a meeting, a secret meeting, and they talked about what they were going to say that was related to the vaccine, with a specific goal of not only making people scared of COVID-19 vaccines, but also scared about vaccines in general, because they saw COVID as an opportunity to undermine confidence in vaccines at large. And I think at some level we see that worked. Their efforts worked, despite our best efforts to try to help people understand what we knew about the science and take them along on what was, an opportunity for the entire world to be on the front lines of science, because we were all learning together. And it's been unfortunate, that they were able to make those inroads, I think.
Yeah, I think just one thing to pick up on something Charlotte said. I think that's such an important point. The people like Robert F. Kennedy Jr. or the other anti-vaccine activists will say, look, the public has lost trust. They've lost trust in the CDC. They've lost trust in the FDA or the National Institutes of Health. They were one of the biggest reasons that there was a loss of trust. There was just a constant attack on the trustworthiness of those organizations or entities by those groups that were very well funded, very well organized, and sort of basically had an attack on vaccines and those who make recommendations about vaccines.
Right. The 3 points they walked out of that meeting with were, let's say that the vaccines, COVID vaccines are not safe, COVID disease is not that bad, and don't trust the experts. They made those rules before there was even a vaccine released to use, before there were even data for us to see about those vaccines. And if you listen and you go back and you look at what the rhetoric was, those 3 themes came across. They were successful.
And what? So okay, if that was the key message, so I mean, it's still, there's got to be something about the vaccines themselves that create enough fear that a parent won't vaccinate their kid, or you know what I mean? There's been years and years of kind of pretty successful, vaccination programs, but it seems like that movement turned everything upside down very, very quickly. I would imagine it would take longer to convince so many people not to get vaccinated or not to trust the vaccine. But it seemed that it did. Could it be this, the political environment as well, everything going on there? But it seems like, to me, it happened very quickly.
I mean, there's a disconnect between what actually happened, I think, and what we're hearing happen, because if you look, most people got vaccinated. But we continue even till today to hear that these vaccines are not safe and they don't work. And, in the United States, that's include removing the ability to do research on mRNA technology. So, it's been a continued drumbeat that never stopped even after COVID stopped.
So on that note, Charlotte and Paul, how much damage has been done since RFK Jr. has taken that position? Because I think he was confirmed in February of 2025, right? And it's been about a year and a little bit. So what are the key, strikes done on vaccine policy and access in the United States?
Well, so I think you see it. It's evident, which is that in last year, 2025, we had the biggest measles epidemic we've had in more than 30 years. We had 3 people die of measles. That equals the total number of measles deaths in this country, U.S., over the last 25 years. We had 2 healthy little girls, a 6-year-old and 8-year-old, unvaccinated, healthy girls in West Texas, die of measles. That was the first child death for measles since 2003. We had more influenza deaths, about 290 deaths in children last year from influenza, more than 115 this year. We haven't seen numbers that big since the 2009 swine flu pandemic. We had whooping cough deaths in states that hadn't seen whooping cough deaths in years. We even had more tetanus cases than we'd had in really 10 years. So the proof is in the pudding, and it's the viruses and bacteria that have thrived. I mean, when people say, the anti-vaccine activists are winning, it's really the viruses and bacteria that are winning. They're now given more free rein to do their damage.
And I think the attack has been multi-pronged. I mean, certainly there are the things you've probably heard about up in Canada, like, firing the ACIP and changing the immunization schedule and undoing the birth dose of hepatitis B vaccine. But there has also been this complete withdrawal, or not complete, but a very big withdrawal of funding for different kinds of research. Again, mRNA technology research grants have been stopped. Any grants that have to do with vaccine hesitancy have been stopped. Any that have to do with DEI. So there's been a lot of withdrawal of funding. There's been a mass exodus or firing of people from our government scientists. And that's been really critical because they had a tremendous amount of information and, support for this larger system, so that our surveillance systems have suffered. Some of the testing is no longer being done. I mean, just recently we heard the CDC is no longer doing testing for rabies. I mean, what? It doesn't make sense. So there's just been this prolonged attack. And when Paul talks about the 2 little girls that passed away from measles, Mr. Kennedy went to Texas to attend the funerals, but he didn't tell everybody to get vaccines. So there's also been this lack of, public health communication that you would normally see in a setting like the one we're having right now. And, we're all going to pay the price for that, unfortunately.
So on the topic of ACIP, that has been a very bizarre sort of series of events. So Charlotte, you were previously on the ACIP committee, and then all of a sudden that committee was released of their duties, and then it was kind of another one was put together in a very, sort of hand-wavy way. And then the last I checked, there was, I think the American Academy of Pediatrics took it to court, and now, like, what's going on with that now? Like, that's just been a bizarre story.
Right. So in the middle of June of 2025, the entire committee, the ACIP, was dismissed. We found out because Mr. Kennedy put out an op-ed. That's how we were fired. We subsequently got fired through email with a very bland email. And the AP, I think, started their lawsuit fairly quickly thereafter, but it takes time for those things to go through the courts. So most recent, he did, as you said, quickly replace the people like myself with others who were not vetted in the same way that we had been. I mean, for myself, it took almost 2 years between when I applied and when I was able to start working on the committee. And I had worked just under a year, and then I had 3 more years of service that I was supposed to continue. And that was the case. There were even people who had completed all of the process and then just never got to sit on the committee. So there's really a group of 22 to 25 people that were, their services were no longer needed. And more recently, the courts did say that committee was not repopulated correctly. And we're waiting to see what happens with that. In the meantime, the Department of Health and Human Services has started changing the charter related to the ACIP, probably in an attempt to make it more likely that the people who are on there could be reseated. But that court case is ongoing, and other things have been added along the way related to the changes to the schedule and other recommendations. So I think we have a while to go yet, but we were happy to see the courts step in.
No, that's great. And just again, providing our listeners context, like committees like ACIP, and for us, we have the National Advisory Committee on Immunization, known as NACI. It's really important to have balanced experts in various fields like pediatrics, infectious disease, epidemiology, to provide that rigor in making these sort of evidence-based recommendations. And I remember I always talk about something that you said, Paul, where it's like someone looks up something on the internet and they claim that it's true, or they tote it and they spread it. But a lot of these guidelines and recommendations are done by real experts, obviously vetted experts from a balanced perspective. And that's why these committees have that gold standard rigor. And it's just been, and even for ACIP, a lot of our recommendations in Canada, ACIP typically precedes it. And we typically adopt a lot of it. A lot of it's just for verbatim. So and other countries do that as well. So it's been really unfortunate to see sort of this gold standard science kind of be torn down almost, overnight. It's crazy.
Well, that's exactly what you would have imagined when Robert F. Kennedy Jr. took over. The last thing he wants is to be surrounded by actual experts. In fact, he said, don't trust the experts. The implication being, trust me, because you can't trust the experts. He is an anti-vaccine activist. He wants to do everything he can to make vaccines less available, less affordable, and more feared. The last thing he wants to be surrounded with are people who actually have an expertise in the subject.
And Paul, when he's challenged on this, generally like by real experts like yourself, like how does he handle himself in that environment? That's the part I find very difficult for a non-expert to really kind of try to contradict experts. It's not an easy thing to do, right?
So he's a one-trick pony. I mean, when, for example, the American Academy of Pediatrics stood up and said, no, we recommend the COVID vaccine for healthy young children. We disagree with RFK Jr. when he made that statement way back in May of 2025. And when he said that healthy pregnant women don't need a COVID vaccine, when clearly they do. Groups like the American College of Obstetrics and Gynecology stood up and said, no, we do need to vaccinate healthy pregnant women because they are at higher risk of severe COVID. He did what he always does. They're in the pocket of industry. They're just, selling a product. They're corrupted because he doesn't have the data. If he had the data, he would present the data, but he doesn't have the data. So he appeals to conspiracy, which sadly does sell at some level in this country.
Yeah, I think we're a little silent here because it's mind-boggling how quickly this can happen and how it can change the sentiment. And Ajit touched upon it there, but we do really rely on the American guidelines here. I mean, NACI's generally slower in Canada, so I mean the experts here in Canada, I mean, when we're trying to translate knowledge, it comes from the Americans generally first, and then our guidance follows. So I mean, this is, as I listen to this, I'm quite worried myself. So then, guys, what's the plan? Like, how do we, take this on and try to get all healthcare providers that are on the front lines kind of working together to try to contradict this?
Well, I'll start, and then Charlotte can give her thoughts. I think there are a lot of places one can look. I mean, the American Academy of Pediatrics, Infectious Disease Society of America, obviously our site, the Vaccine Education Center at Children's Hospital of Philadelphia. There are many places where you can go to get good information about vaccines and that science-based recommendations about vaccines. What's changed is we used to just look at one place. We used to look at the ACIP and at the CDC. Now it's more fragmented, which makes it more difficult to get that information, but the information is there.
And I would just add that I think in addition to the professional societies stepping up really there have been a lot of stakeholders that have stepped up, and you may have heard of the Vaccine Integrity Project, which is out of the University of Minnesota, and they've really been convening groups of experts on specific subjects. So last fall, they looked at the 3 respiratory viruses, COVID, influenza, and RSV, and did a literature review, a systematic literature review, and I think a great evaluation. Some of the groups also did. But they put together the basic information, and then they put that out, and the different professional societies then reviewed all of that data and made their recommendations. So like Paul said, we're looking in a variety of different places now, but we still are doing our best. I think really the professionals have come together in the best way we can to try to fill the holes that are missing at this moment. And it's not a perfect system because there are still things we're missing from the government, but at least we're not all flying in the dark, if you will.
Yeah, and I think the other key thing that I personally, kind of learned from all this is we also have to, Charlotte, you alluded to it, it's like, the anti-vaccine movement or whatever it is, it's organized, it's creative, it's, like we can still be organized and creative as well in our messaging because obviously it's scientifically accurate. So I really like the newsletter that's coming out of Children's Hospital. I think that's really important to stay up to date. And then even Paul, you've been kind of doing a foray into things like Substack and even doing wired autocomplete, which is usually done by celebrities. So congratulations on getting on that. I think there was almost 500,000 views of that video. So science is cool, everyone, right? I think it's we gotta lean into that, and it's not just typically it's just public health giving out boring pamphlets, right? And we have to kind of get creative as well. Like, what are your thoughts on that? What is your experience kind of doing more creative messaging? How have you been finding that?
No, I think you're right. I think, and I learned this mostly from my daughter. How do people get information today? And they don't want long format pieces of information as a general rule. So things like, TikTok and Instagram, the quick hits is much better. I also do, in addition to the videos we do at our Vaccine Education Center, I also do a video with Vincent Racaniello. Microbe TV is out of Colombia. So we're just sort of constantly trying to put things on YouTube that that give information out there in a variety of different formats. And Charlotte is just a master of this kind of thing at our center, trying to get as much information out there as we can in a variety of different ways because people acquire information differently and you're trying to appeal to a broad population.
Guys, I had a question that I may seem odd, but I really wonder about this, and I thought I had to ask you guys, how is Dr. Fauci? I remember during the pandemic, he was such a calming voice. I thought he did a great job just resonating with the general public. And then I actually really worried about him during the next administration there. And then he kind of just disappeared. Is he still vocal in the U.S.? Like I don't even see much of him on the news here in Canada. And might be an odd question, but I was just curious. I thought I'd ask you guys.
So he's doing fine. I do still hear occasionally from Dr. Fauci. He has gotten quieter. That's true. Because whereas to me, he was a hero. He was willing to stand up and speak for the science to the public. And as Charlotte said earlier, we learn as we go. We didn't always get it right, but we got most of it right. And certainly that vaccine was safe and effective. And certainly it saved a lot of lives. And certainly there were probably more than 200,000 people who lost their lives because they chose not to get that vaccine, whereas at least 3 million people in the U.S. had their lives saved by that vaccine. Thank you, Dr. Fauci. But I think, that it became political, and people like Rand Paul, who's a Republican from Kentucky, has sort of taken it upon himself to really do everything he can to make Dr. Fauci's life miserable, all having to do with whether or not the U.S. through NIH paid money to the Wuhan Institute of Virology to do gain of function studies, and that's how this virus was created, which is completely wrong. This wasn't a lab leak. This wasn't created in the Wuhan Institute of Virology. It was an animal to human spillover event that occurred in the southwestern section of the Hunan wholesale seafood market. All the data support that. But nonetheless, this is sort of a Republican theme right now, which is the lab leak theme, although 2/3 of the American public currently believe that. But I think he's just laying low, but certainly he's otherwise fine and in relatively good spirits.
No, I'm happy to hear that, because he was, I think, a hero to many of us here as well, and I kind of really disliked the way, they attacked his reputation and everything else at the end, because I thought in the midst of the pandemic, he was a very calming voice. So I'm really glad to hear that.
So Paul and Charlotte, for frontline healthcare professionals, and I'm drawing on a recent Substack article that you wrote, Paul, about a U.S. pediatrician kind of saying, explaining vaccines to parents is now kind of equivalent to pilots explaining what every button does on the plane to every passenger before they board. And a lot of our pharmacist listeners, especially in Manitoba, are just starting to inoculate children who haven't been vaccinated for measles just earlier this month, or maybe it was last month. And why is measles like you call it the canary in the coal mine? Because it just explodes very quickly. It's likely because it's super contagious and you need high vaccination rates. But for our pharmacists starting to administer MMR vaccination, what are like some key conversational tips to have, and what sort of misinformation do you think parents are coming with who previously did not vaccinate their kids specifically against measles?
Right. So measles is the most contagious human infection. When immunization rates start to fray, measles is typically the first virus that comes back. I think we eliminated measles from the United States in 2000, but at the same time, I think we largely eliminated the memory of measles. I think people don't remember how sick or seriously ill or occasionally dead that virus can make you. And so I think that people need to understand that this is a serious virus. And I'll give you the thing that worries me the most right now. If you look at how many cases we've had in this country, it's been about 5,000 cases, and it may well have been more than that. Once you start to see that level, there's another disease that you're going to see 5 to 7 years from now, and that's so-called subacute sclerosing panencephalitis, which is a chronic measles infection of the brain. I've seen a handful of cases in my lifetime, my medical lifetime, and they are devastating. I mean, you get measles, you recover from measles, and then the virus is continuing to reproduce itself at low levels in the brain, slowly destroying the brain. And you see children come in with initially changes in personality, deterioration in handwriting skills, and descend into a vegetative state from which there is no escape. There is no treatment for that. It is a uniformly fatal disease, and it is preventable. And you're going to start to see that now in the United States a few years from now. And I hope that we make it clear to people that this is what happens if you get measles. This is not just some mild fever and a rash that goes away. It can cause severe pneumonia, severe dehydration, encephalitis, which is inflammation of the brain. This is a bad disease, and we eliminated it. And I think we just have to realize that we need to explain to parents in a passionate and compassionate and compelling way what kind of risk you're taking when you choose not to get a vaccine. If you choose a choice not to get a vaccine is not a risk-free choice. It's a choice to take a different and more serious risk. You can protect your child here, and that's your job. Put your child in the safest position possible.
Well, it's a great point, and I think you alluded to it in your Wired interview about survivorship immunity, right? Where it's kind of like paying the price of "quote unquote" natural infection, and it may manifest. So for measles, as you're mentioning, it may manifest as mild illness, but then that's not where it ends. There's this insidious longitudinal sequelae that can happen, and I think that's really important. That to anyone who's vaccinating children against measles, and if parents have questions, I think that's a very important thing to bring up.
Charlotte, pharmacists here in Canada have taken on now the bulk of the job of immunization. I mean, our scope varies depending which part of the country you're in and which vaccines you could administer or prescribe. We don't have scope that's harmonious across the country, but it's moving forward quickly, I think, in most provinces. And I think if you were going to give pharmacists, 2 or 3 therapeutic pearls. This is, how you combat this movement on the front lines, because we do see it, and pharmacies are very busy places. You get, a patient, you got 100 people waiting, and you have a parent or a patient that's kind of on the fence there, and you're worried about going down that wormhole. Like, if I start this discussion, because they may not be anti-vaxxers, but they have quite a bit of hesitancy. How do I approach it so I get the most bang for my buck? Because in the practical real world, these are the things our pharmacists are kind of trying to weigh, right?
Right. I think the first thing is to have empathy, because the reality is all of us are struggling in this information environment. We're all basically victims of the same environment. So starting with that, and then coming to the point that it's this, we all have the same goal. The pharmacist and the parent in front of you have the same goal of keeping that child healthy. And so again, just reminding them that you have a shared goal, and then finding out what is their question. And then even if you don't have the time to answer that question, or you maybe aren't familiar with the answer to that question, because the reality is a lot of these parents are doing research and they're coming in with very nuanced questions that do require a lot of time. That's when I suggest passing the baton to another healthcare provider, right? That's how we all work together, because you might be the person in front of that individual at the moment. If you say, I don't have time to answer that, or that's not a good question, or you just in some way dismiss them, whether it with your physical actions or your verbal responses, they're going to move further away from vaccinating. If you don't have the time or the answer, you can say, you know what, that's a great question. I've looked at that. Here's a place where I know they respond to that. Or, I'm not really sure of that. Let me get you a resource where you can answer that. And that's how you pass the baton to the next person, because you're showing them that you hear their question, you want to respond to their question. You maybe can't do it right in this moment, but you are going to work with them to get that answer. And I think that's hard, because like you said, everybody on the front lines is very busy, but the parents just need their questions answered. And one of the things I like to say is, somebody having a question doesn't mean they're vaccine hesitant. And unfortunately, I think we, the professionals, all use the words vaccine hesitancy a little bit too freely these days, because I don't think most people are vaccine hesitant. I mean, one of the hopeful things in the United States out of everything we've been dealing with over the last year are the surveys that come in that say 80 to 90% of parents support vaccines, and they even support vaccine mandates. And that doesn't matter what their political affiliations are, what part of the country they're in. That you don't get people to agree to that high of an amount on anything these days. So most people do want to vaccinate, but they're going to have some questions because they're hearing things, and as part of the due diligence of being a good parent, they need to check it out before they move forward.
Well, that's great advice. Paul, anything you want to add to that? You had a couple of pearls? Yeah.
It's such an important point. I watch my wife, who's in private practice, pediatrics, deal with this, and people really are scared at some level of these vaccines, because they read very scary things on the internet. They're not compelled by the disease because they don't see the disease much these days. And she said that when she convinces some parents to get a vaccine, that the parent will be crying while the child's getting the vaccine, because they're that scared that this vaccine could be harmful. And so I think Charlotte's point that you have to be empathetic. You can't dismiss their fears. Their fears are real, very real to them, and you have to do the best you can to sort of try and talk them down off those fears by being compelling and passionate and clear. So I think, and we do, just taking a step back, we do ask a lot from parents in this country. We ask them to, in the first few years of life, get vaccines to prevent 14 different diseases, which can mean as many as 5 shots at one time, as many as 25 shots during that whole time, to prevent diseases most people don't see, using biological fluids most people don't understand. So I think the pushback is understandable, and that's why Charlotte's point is so important when she says the term vaccine hesitancy probably isn't right. It's just a reasonable skepticism given the current state of affairs. You should be skeptical of anything you put into your body or your child's body.
a great point. So I guess Paul and Charlotte, just kind of looking at what the future holds, what do you think would be the best way to kind of navigate public health in the United States and even globally back to where it should be?
Well, I think after listening to what you guys are saying, Charlotte and I are going to be moving to Canada. I see this. I just
You're more than welcome to.
I think ultimately the good news is science does win out in the end. It does. I mean, the fact is no matter how many times Robert F. Kennedy Jr. says vaccines cause autism or diabetes or multiple sclerosis or whatever he says, or how many discredited physicians or discredited scientists or media venues or politicians he gets to agree with him, he's going to be wrong. And that's going to be shown to be wrong again and again and again. And ultimately, science does win out. It has consistently won out. It is a powerful thing to have on our side.
Great point, Charlotte. Anything you wanna add to that?
No, I think Paul's right. He said it earlier. The pathogens are the ones who are winning right now, and unfortunately, people are going to start to realize that as these diseases come back and they see them, and it's unfortunate that we need to have that happen. But science is on our side. I mean, we're not sharing our opinions when we talk about vaccines. We're sharing what's been learned from a scientific approach to all of this. And, hopefully sooner than later, things will start to come back to a more normal place of, having conversations, using critical thinking, and being able to sort through where to get information, that's based on that scientific data.
Well, thank you so much, Paul and Charlotte. I think the main thing that I found came across in this conversation was your passion to really make sure that everyone has the right information and your passion behind scientific literacy. So I think for our listeners, and especially those who are providing immunizations or just starting to in this current world state, I think some of that passion, if it can be distilled to them and they can use that to support their own patients, I think we're definitely on the right path. And great work on all the resources that you're doing. Me and John are following it, and we'll leave some links in our show notes. And keep in touch, keep up the great work. And yes, if you do want to come to Canada, you're more than welcome to.
Yeah, we'd love to have you on the podcast in studio. It's a different experience, but thanks again, guys. I think it was great. It was so nice to meet you both.
Thank you
Nice
both,
meeting you.
and thank you for all you're doing.
Yes, thank you.
Now